Many drugs and toxins interfere with neuronal transmission. Some snakes produce venom, which helps to immobilize their prey and prevent them from running away from the snake. These venoms work by blocking the neuromuscular synaptic transmission. They can work in two ways, either preventing the release of acetylcholine from the presynaptic terminal or preventing the binding of the acetylcholine to the postsynaptic membrane. You may be familiar with Botox, which is used in cosmetic surgery nowadays to make people look younger, for example by removing wrinkles. Botox is produced by the bacterium Clostridium botulinum, which is commonly found in the soil. The Botox toxin works by preventing the release of neurotransmitter. So in other words, the Botox toxin works at the presynaptic terminal. In the 1990s, there were 2 nerve gas attacks in the Tokyo subway. Members of the Cult of Doom in Japan released the sarin nerve gas at 2 locations in Tokyo. How does sarin work? It actually interferes with the action of acetylcholine esterase. Okay, so in other words, it prevents the breakdown of acetylcholine. Many pesticides and insecticides also contain chemicals that interfere with neuronal transmission. Baygon, for example, contains active ingredients that keep voltage-gated sodium channels open longer than usual. In other words, the neurons become hyperstimulated. Hence, whenever you use Baygon on a crawling or flying insect, they will convulse and eventually die. Okay. This graph shows you the action potential in cardiac muscle cell. Okay, so it looks somewhat different from the typical action potential in a neuron, because in cardiac muscle cell, the action potential involves this. Other than involving the sodium and potassium channels, it also involves the calcium channels. So there is this part here that looks a bit different. So drugs that are used to treat heart problems such as heart rate being too rapid or heart rate being irregular, by acting at different parts of the action potential in the cardiac muscle. For example, some classes of drugs block the sodium channels. And sodium channels are involved in depolarization, so when they are blocked, the onset of depolarization is delayed, or the depolarization becomes prolonged. Okay, so there's a shift in the depolarization to the right. The gradient is less steep. The other type of drugs work by blocking the potassium channels. Potassium channels have a role in repolarization, so when the potassium channels are blocked by these drugs, the repolarization takes longer to complete, as shown by the graph in red. Lastly, we have another class of drugs that block the calcium channels. So the calcium channels, in the case of cardiac muscle, are also involved in the depolarization. So when the calcium channels are blocked, the depolarization takes longer to complete.